Hello guys, welcome back to my YouTube channel Marcella Putri. Okay, good evening everyone. Good evening, share. Thanks for the time you have given me. On this occasion, I will read the text. Education patients about their medication, the potential and limitation of reaching true information, and I will also explain the use of positive imperative and negative imperative and the profit example and writing to translate the following sentence into communicative English. Education patients about their medication, the potential and limitation of reaching true information. True information on labels and insert is a major source of knowledge for patients as they attempt to balance the risks and benefits of truth and administer them safely. And yes, this information is often inconsistent, incomplete, and difficult for patients to read and understand. We reviewed the numerous sources of written preparation through information, the regulations that govern the content and format, and the lack of oversight in the process, and the history that led to this system. We suggest that oversight and standards are needed so the written true information can serve as a coherent and organized system to educate patients. To make truthful decisions about taking medication and to take them safely and appropriately, patients must have at least a basic understanding about the risks and benefits of their prescribed drugs and how to administer them. Recent safety problems associated with commonly prescribed and aggressively advertised medications such as the COX-2 inhibitors and antidepressants have addressed awareness about the importance of considering medication risks. In its 2006 report preventing medication errors, the Institute of Medicine (IOM) highlighted the pervasive problem of poor medication safety. Ideally, patients should receive counseling about risk, benefits, and safe administration of medication from their physicians and pharmacists. Surveys indicate the most patients prefer to refer this information from their pediatrician as limited internal medication. However, that is considerable evidence that such symptoms infrequently and are often quite limited. A recent study evaluated additive office visit and found major shortfalls in the quality of information communicated to patients about their prescribed medications. Physicians explain effects and duration of therapy in only about a third of the discussion and provide patients with instructions for us in only 55% of the discussion. Communication with pharmacists is also inadequate. As a result, many patients rely on written information, error or labels, or in prescribed insert. Sources of writing, prescription through information container labels and CMA levels. Patients have several sources of writing information about prescription drugs. The container label provides basic true information such as the true name, dose, instructions, pharmacy, and patient's name. The container also sometimes includes auxiliary stickers to communicate additional warning and administration direction. Supplementary leaflets often accompany prescription valid never to as consumer medication information. CMA, these have more surface area than the container labels and are asked to communicate additional information about medication directions, rights, and benefits. Package insert. Some drugs are dispensed with a package insert, a document operated by the Food and Drug Administration (FDA) that contains scientific information about pharmacokinetics, pharmacodynamics, molecular structure, indication, rights, and benefits. Despite recount formatting change to simply readability, this document should take file legible emit at scans but is frequently delivered to patients via single dose containers packaging by the manufacturer. Number 2. Positive imperative. As imperative sentence is asked to give instruction. There are two kinds of imperative sentence: positive imperative and negative imperative. Number 1. Positive imperative. Asked for giving positive instruction, preferred at the beginning of sentence. Precede the sentence with place to make police instruction. To the example, number 1, please check on that patient. Number 2, please pass the infusion on. 3, please clean the patient wound. 4, please take medication immediately. 5, please eat immediately. 6, please check the pulse. 7, please treat the wound. 8, please check the blood pressure immediately. 9, please inject the patient immediately. 10, please immediately administer oxygen to the patient. Number 2, negative imperative. Asked for negative instruction, but the word don't at the beginning of sentence. To the example, number 1, don't examine the patient, don't place the infus, don't clean the patient wound. 4, do not take medication. 5, don't eat. 6, don't check the pulse. 7, don't treat the wound. 8, don't immediately check the blood pressure. 9, don't inject the patient. 10, don't administer oxygen to the patient. Number 3, writing. Translate the following sentence into communicative English. Number 1, Do not ex- do not examine the patient. Number one, take medication regularly. Two, do not consume a lot of salt. Three, don't open your eyes. Four, do not drink alcoholic beverages. Five, go to the Ronald Doctor Clinic now. Okay, thank you.